Hello everyone, welcome back to Medical Coding Club. This is Chandrika, and in today's session, I am going to review all the ICD-10-CM conventions, so which will be interview focused and also exam focused. So even if you have learned everything in detail, this session will help you to revise all the concept regarding conventions, and you can able to remember that particular points to get the interview, clear. And also if you want in-depth training like the practical example and the book navigation and all the practical scenarios, you can join my 2-month CPC course where you can learn everything effectively. So let's begin. So before we start coding, we need to understand the rules of the ICD-10 system. Those rules are called ICD conventions. Okay, so these conventions are already built into your ICD-10 book and they're found throughout your alphabetic index and also tabular list. Okay, and many coding mistakes happen not because coders don't know the diagnosis code, but because they will skip some portion while leading the code. Okay, when they don't understand alphabetic index and how we lead the code, then there will be some kind of errors that we will be getting. Okay, so for that reason we should master all the ICD conventions. And one interview question here is, what is the main difference between ICD conventions and guidelines, ICD guidelines? Okay, so you should be able to tell them that conventions are built into the ICD classification itself, like they are foundation, and they're not separate rule, I mean not separate guidelines to follow for a particular condition. Okay, it is for general for all the chapters. And also, like, you conventions are nothing but instructions how we need to code. Okay, so these instructions are called as ICD conventions. But when we talk about guidelines, so guidelines are something, they provide additional instruction for our diagnosis coding. And we do have general guidelines and we do have chapter specific guidelines. So chapter specific guidelines are for particular conditions. Okay, based on body system we get to see a lot of guidelines. And you can see here I've added all our 19 ICD conventions. All of them are very important, and for interview any 2 to 3 questions can be asked from the ICD conventions itself because it is very basic. And as I said, in this particular session I'm going to review them. Okay, I'm not going to add all the practical example. Instead, at least I'll give you some points to remember. Okay, so yeah, let's begin. So our first ICD convention is alphabetic index and tabular list. So you should know about your ICD book. ICD book contains alphabetic index 1 volume and tabular list. Under alphabetic index you get to see 4 different sections as well, like external cause code and neoplasm table and also drug. Okay, and then our conditions which are organized alphabetically. Okay, everything in your alphabetic index. But coming to tabular list, in the tabular list the conditions are organized into chapters which are based on body systems. Okay, and tabular list contains a complete description of the code, instructional notes. Okay, we will be finalizing our diagnosis code under tabular list only. Okay, so there could be an interview question, why can't coder assign a code directly from alphabetic index? So you should be able to tell them that alphabetic index only provide the suggested code and the tabular list contains additional instructions like exclusions, like exclude 1 and 2 nodes and other requirements. So it should be reviewed under tabular list only to finalize our diagnosis code. Okay, so never just land on alphabetic index. Make sure whatever the guidance or whatever the code you got in alphabetic index, you come and verify that code in tabular list and see any instructions are applicable for that code and follow that. Okay, so these are the points you should remember about alphabetic index and tabular list. So next, format and structure. In our ICD-10-CM book or our coding system, codes are organized into categories, subcategories and complete reportable code. And the category contains 3 characters, while additional characters provide greater specificity regarding patient condition. So mainly here, whenever you see category codes which are not further subdivided, we will conclude them as a complete code. Okay, And while reporting a complete code, we must make sure that it is reaching greater specificity available in our ICD book. So the interviewer can question like, can a 3-character category always be reported or can be reported? So you can say, or you can tell them answer as no, and you should also give the explanation like 3-character category can only be reported if it is not further subdivided. Okay, so that means hypertension example I-10, we have only 3-character code in that, but it is not further subdivided, so we conclude that I-10 as a complete code. Okay, so that is how our entire book is designed, based on categories and subcategories and a complete code. Next, use of codes for reporting purpose. So whatever we learned in format and structure, same thing here. So as you can see that to report a valid diagnosis code, we must make sure that whatever the code that you are giving or assigning, it is reaching the highest level of specificity supported by provider documentation. Okay, you should not send any incomplete codes on the claim, so it will be an rejection. So whenever you are assigning your diagnosis code, make sure that you are giving a valid, complete code and you are reaching the higher specificity available in your book. Okay. So next, placeholder character X. So please be aware about this character X, and the X is used to maintain the proper code structure and to ensure the required characters appear in a correct position. Okay, it is commonly seen in your injury or poisoning and the codes which are requiring 7th character. Okay, in middle, if we do not have any character, they generally have this placeholder as X. Okay, they will use this X, and it will be like, it acts like a room for future expansion. In the place of X, if they want any digits further in any upcoming expansions, they may use or they may introduce a code in that particular area, but as of now they will fill that empty space utilizing the character X. Okay, so why this placeholder X is important means, the placeholder ensures that ICD-10-CM code maintain the correct format. Without a required placeholder, then code becomes invalid and cannot be reported correctly. So if you consider your initial encounter 7th character A, same way subsequent encounter character D and sequel IS, okay, all of these character we will be reporting in the 7th place. Okay, we cannot keep them in the 6th place. If we do not have 6th place, any character or any digits are not missing, in that instances they'll utilize this X, okay, mainly in 5th and 6th position. So that's how X is important in our ICD-10 book. So next, 7th character. So you can see that the 7th character provides additional information about the encounter, such as initial encounter, as I mentioned, character A and alphabet D and S, and we do have a lot of other alphabets that we use in 7th character based on Gustilo classification, which you can learn in chapter injury. Okay, and also you can see what happens if a required 7th character is omitted. So if required 7th character is not reported, the code becomes invalid. So if you just send without your encounters, okay, information, and if you're just sending a 6 code for your injury, then this code will become incomplete or invalid on the claim. So next, what does NEC and NOS stands for? Okay, both of them are very important. So NEC refers to not elsewhere classifiable and NOS refers to not otherwise specified. So mainly not elsewhere classified, that is NEC, is used when provider documents a specific condition for your ICD-10. Now, I mean, for patient condition, the doctor has given enough details, but in our ICD-10 book or in our software, we do not contain a unique code for what provider is saying. Okay, so then we gonna assign NEC, which is not elsewhere classifiable, which is also considered as other specified code. But when doctor is failed to give enough details, but we do have a lot of codes for that category, for more details, then we gonna assign NOS a code, okay, which is equivalent to unspecified code. Okay, very important, both of them. So in my classes I'll explain everything, what is NEC, NOS, all of this with details, with practical examples in book how they have mentioned. Okay, so you get to see a lot of example in live classes, but here it is very much hard to explain, to cover all those things. And then for interview it is a definite question. Please be aware at least about the abbreviation, which stands for NEC and NOS, and some details about it. Then we have punctuations, and we do have four punctuations now. We do have brackets, parenthesis, colon, and also comma now. Okay, so comma is also introduced in 2026. So mainly all of these punctuations which we are seeing in our ICD-10-CM have some importance. Okay, so you can see what do the brackets indicate. Brackets have two importance, or they've used for two different purpose. So brackets are used to identify manifestation codes in alphabetic index, whereas in tabular list they have used brackets to enclose synonyms or explanatory phrases. Okay, this question also asked in current year CPC exam in the coding guideline question. So please be aware about the two different importance based on your index and tabular list for brackets. Same way parenthesis contains non-essential modifier which will not affect any code assignment. Okay, and colons indicate the additional terms following which are needed to make the statement complete. And also comma is used to give a separate entry. Okay, so please remember that new punctuation is comma in introduced in 2026. So next you have include terms. So an include note appear directly under category or code that provides additional clarification regarding the conditions included within the code category, and it may define code for provide example condition classified under the code. So it is like what to say. The main thing here is that conditions that belong within the category or code, it helps coders to understand its classification or a scope of the code. Then you can check the interview question also. Then comes to inclusion terms. So these inclusion terms are examples of conditions which classified, or the particular code being assigned. So they are provided for guidance and are not intended to be a complete list. Okay, this will give you some additional information about that medical condition. So next, very important, exclude one note and exclude two notes. So an exclude one note means not coded here, and generally indicate that the two conditions cannot occur together or reported together. So these conditions are considered mutually exclusive. Same way, exclude two notes refers to exclude condition is not part of the code, so that condition may exist together, and also when it is appropriate you can use the both code. Okay, so just key points: exclude one, only one ICD will be coded; exclude two, both ICD can be reported. Okay, you should really have good understanding on both of them. Okay, please refer your your tabular list, and you see a lot of medical condition codes will have this exclude one notes below to that code. So like you will, when you start referring page by page, you will be able to see a lot of examples for exclude one and exclude two. So next we have etiology and manifestation. So etiology is an underlying condition, manifestation is a secondary process of it. So you have to remember these two instructional note, what is code first and what is use additional code. So code first note instruct the coders to sequence the underlying disease condition before assigning the code. So many of the coders will misunderstand what is code first instruction. So they see code first under manifestation codes. Okay, they think we, like, as they are seeing code first under manifestation code, they think this manifestation code should be coded as first. Okay, not like that. Under manifestation, if you are seeing code first, that the meaning of that is you need to go and assign the underlying condition in the primary diagnosis place, and then only you have to code the manifestation. That's why in all the manifestation code, you see instruction as code first. That means code etiology. Same way under etiology medical conditions, you go to see use additional instruction note. Okay, so that means check any applicable manifestations available and code it accordingly. Okay, so very important, both of the terms, and please read through. Then and, so as you know that in normal English and refers both, but in our ICD-10 manual we interpret and as are. Okay, that means we always have this option to choose. Okay, like we will have some categories where we have two conditions, but sometimes patient may have only one conditions. Okay, but the term is end with and, we do not have to sit and think like I do not have both the condition. So since and is interpreted as are, okay, even if you have any one conditions in the same description or in the same code, that will be fine enough to code that ICD. So next with we have with is like we use it for a combination code. So you should have again a very good understanding on with also. So you can see this with interpreted as a meaning associated with or due to when conditions are linked by term with an alphabetic index or tabular list. So generally when you see the term with, we are going to assume a causal relationship unless you get a documentation states otherwise from the provider. Okay, you have a lot of example for with, like diabetes with CKD, hypertension with CKD, hypertension with heart disease. Okay, all of these terms are linked with only. So generally for combination code you use the term with. Next, C and C also instruction. So you get to see C and C also instruction in alphabetic index while reading your ICD code. So please remember, C refers to you have to mandatory go and check the term that they are referring. C also will give you, it may be referred if you are having enough. If you are like, if you are getting a code within the index, that is fine. And further, if you see C also, then for your cross reference, for your additional reference, you can go and see that term as well to conclude your ICD code. Okay, these two terms are very important, which are there in your alphabetic index. And then code also note. So code also refers to, that indicates the two codes may be needed to fully describe the patient condition. Sometime when you are coding, like you have some condition and the organism is missing, so to code that organism you may take the another code. Okay, so which is more or like use additional. But for code also, what is the instruction means, you do not have to follow any sequencing rules. Okay, but when you're seeing code first instruction, there were we had a sequencing rule, but under code also instruction you do not have to follow any sequencing rule. Based on reason for encounter for that particular visit, we will be sequencing that code. Okay, and read the interview question. Then we have default codes. So default code is something like, in the alphabetic index, it represents the condition most commonly associated with the term, and also provider lacks more specificity on that. Like when the doctor says appendicitis, you just and you do not have any further information about appendicitis, it becomes your default code and you are gonna assign the same code. Okay, that is about default. And then comes code assignment and clinical criteria. So here whenever you are assigning a code, it should be, you should have a diagnostic statement from the provider end, and the lab reports will not justify your final diagnosis. Okay, always make sure that you have a diagnostic statement saying that condition is positive or negative from the provider end. So we give more priority to the provider. If any conflicting statements are available in your medical record, then you are allowed to query the provider. Okay, so that is about code assignment and clinical criteria. So far we have discussed about all the conventions which we have in our ICD-10-CM manual, and as I said already, I did not went in depth. Instead I just gave you the briefing so that you can remember some points for interview purpose. And if you need complete practical knowledge, like with all the examples and scenarios, you can plan joining my 2 months of live course. So you get to learn a lot of things there. Okay. And then like for guideline usage and for interview, this much information is enough for you. So if you feel like I'm going a little fast, so please pause the screen and please do read the slides. Okay, this information will be helpful for you. And that's all. Thank you all for watching, and please do subscribe to my channel, and please do share with your friends. And also batch is starting from June 18. If anyone interested, you can WhatsApp me or you can enroll on my website as well. So here is a detail about the next class. So for more details, please do check on my LinkedIn page or my Instagram or maybe on my website, or directly reach me on my WhatsApp with your details. So thank you all.